Now, our original series, Project Home. For several weeks now, homeless service providers have been sounding the alarm about the dangers of shelters during COVID-19.
Well, tonight the city announced it's heard them loud and clear. The homeless will now be moved out of the shelters and into hotel rooms. KPIX 5 Susie Steimle talked to providers who say this isn't happening quickly enough.
Like I said, I keep hearing that they're going to do the right thing. I'm hoping to see them actually do what they say they're going to do.
On week 4 of San Francisco's shelter-in-place order, tens of thousands are still unable to do so. Mark Roth has been staying in a navigation center along the Embarcadero where social distancing is impossible.
Then you've got your beds that are 3 inches apart. So how do you stay 6 feet apart from people when they're sleeping 3 inches away from you?
In a drastic change of direction, the city announced it will now start doing what homeless providers have been asking them to do for weeks now: move at-risk people out of congregate living spaces and into hotel rooms.
We need to all think about making changes to avoid having an outbreak or situation in places like Moscone West.
It was just last Wednesday that Mayor Breed announced a plan to move people into Moscone West to thin out the existing shelter population, saying that moving the homeless population into hotels was challenging.
I know that we have thousands of hotel rooms here in San Francisco. And I know that people are asking, well, why don't we just open the doors and let everyone who's homeless get access to a hotel room? And I wish it were that easy.
They haven't even put in barriers. I mean, they haven't even done the plastic sheeting between the beds.
Jennifer Friedenbach is the executive director of the Coalition on Homelessness.
Unhoused people are really afraid. They feel like the city's killing them.
3 newly confirmed cases of COVID-19 at San Francisco shelters have only added to the concern that providers have that the city has waited until people are sick to move them. Public health experts say individual hotel rooms are the safest option.
I think obviously in an ideal setting, we would move everyone from shelters and encampments into private hotel rooms. That would be the best.
The hotel industry is stepping up to help, partially because they themselves are struggling. 40 of the city's 215 hotels have temporarily closed, and a majority have had to lay off staff. So they've identified 10,000 rooms as places for people who cannot self-isolate. Though admittedly, there are still a lot of questions as to how this will work.
What does it mean for the hotel? What does it mean for the employees of the hotel? And then also, after the quarantine is over, what does that mean?
Public health experts have also been pushing to see this population tested.
I think that that would actually be a very reasonable use of limited testing resources.
Mayor London Breed has been at odds with the Board of Supervisors and homeless service providers on how quickly to fill these hotels. So far, 190 rooms are occupied by the homeless. 945 rooms are under contract for that population. 30 rooms are occupied by first responders, and another 883 rooms are under contract for them. In the RFQ obtained by KPIX, we get a glimpse into how this will work. The contracts will last a minimum of 4 months. There will be 2 categories of hotel guests: people who cannot self-isolate, like the homeless, or people being discharged from the hospital, and first responders. Hotel staff will care for first responders as guests, changing their linens daily and cleaning their rooms, but food will not be provided. The city, in turn, will run the rooms meant for isolation. 3 daily meals will be provided, but cleaning services will not be. Security guards will also be present at the hotels for the homeless.
Do you think it's moving too slowly?
I think it's moving way too slowly.
Providers say they want to be involved. They're asking the city to let them help run these hotels, which is something the city of Oakland has already done. Jennifer says acting quickly here is paramount to saving lives.
And if we do it in partnership, we can get it done. And it's not going to be perfect, but we don't have time for perfection.
This is an opportunity to take advantage of what's going on and build a real solution, and it's all talking, no action.
The priority population for these hotels is anyone over the age of 60, and of course, anyone with any underlying health conditions. Ken and Liz.
And Susie, how long will people actually stay in these rooms?
Yeah, that's the million-dollar question, isn't it? Once you get people into these hotels, what does it look like transitioning people out? And no one really knows right now. Homeless service providers, of course, are hoping that this will lead to some kind of permanent housing. But the mayor at her press conference today talked about how Moscone West might be an integral part of transitioning people out. Once they test negative and get over COVID-19, they might be able to go back into a shelter situation and then open up a hotel room for somebody else who needs it. But we don't really know until this all rolls out.
And we're talking about thousands and thousands of people. It's a monumental effort. Susie Steimle, thank you for that. Hey, keep sending your stories and your ideas to Project Home with CBS.com and see all of Susie's reporting on our website.